The other issue that we want to focus on this morning is universal healthcare. Remember, it's one of the key pillars of President Uhuru Kenyatta. And I'd like to take you now to Nyeri, where our Raquel Muigai has been following up on this story. Remember, Nyeri is one of the pioneer counties in terms of universal healthcare. Raquel, good morning. Can you hear me?
Yes, Linda, good morning to you. Here in Nyeri County, one of the pioneer counties in the Universal Healthcare Program, a very great pillar, and also included in the Vision 2030. The Kenya's roadmap to a middle-income economy prioritizes health as a social aspect, as a very major component of social aspect. Now, the universal healthcare coverage is meant to at least release that burden of out-of-pocket expenses when it comes to medical covers or medical issues. Now, at least according to statistics, 32% of Kenyans get to survive on at least 2,000 shillings a day. If you get to look at this particular statistics on another angle, is that 40% of non-food bills get to cover medical expenses in at least half of the counties in the country. And therefore, having this particular universal health coverage in the country will get to serve at least a majority of Kenyans who will be looking for health services. And at the end of the day, it is a right to every citizen. But right now, given that Nyeri County is one of the major one of the 4 pilot counties, I do have with me Governor Mutahi Kaiga, who will just give us a brief on exactly what is it that we are doing, what are some of the accomplishments that we've made, and probably also the challenges that we are facing in trying to get universal healthcare coverage in the county. Thank you so much, Mutahi Kaiga, for joining us here. But just let's start with the strides that we've made towards universal healthcare program. We've seen refurbishment of the Provincial General Hospital. What are some of the strides that we're making towards universal healthcare coverage?
Thank you very much. We really must begin by appreciating greatly that Nyeri County has been chosen as one of the 4 pilot counties, even though we regret that we are there because we have a high prevalence for non-communicable diseases. And my government has prioritized health. And this year alone, we have allocated 2.55 billion Kenya shillings towards the health docket, with indeed quite a lot of that money, 2.3 of it going to 2.3 billion going to recurrent expenditure, and just about 210 going to development. Currently, we are doing quite a number of things on different fronts, but essentially we are trying our very level best to strengthen and increase capacity within our healthcare centers, starting all the way from the level 1s, that is the dispensaries, the health centers, coming to the level 3s, and finally to a county referral hospital, the old Provincial General Hospital, or the Nyeri County Referral Hospital. Within the hospital, we are working very, very hard, and we have actually prioritized and allocated close to 80 million Kenyan shillings towards the refurbishment of the outpatient department, which was actually in very, very bad state. We are working hard on it to give it a facelift, also to increase its capacity. We are working also on, in the same hospital, towards improvement of waste management. We are currently fixing an incinerator that will actually take care of the entire waste of the county. That is worth about 10 million Kenya shillings. Our morgue was really in very bad state, had a capacity of only 15. The bodies have risen to almost close to 30, 40. We are working on it and giving it a facelift. That is only on the county referral hospital. We are going further to increase capacity by hiring more clinical officers, and this year alone we'll hire 6 new doctors, just to increase the human capital, and to ensure that when patients are referred to the county referral hospital, they are able to get the specialized and relevant medical care. This one alone is not the only thing we are doing. To decongest this county referral hospital, we are working on the satellites going to Mount Kenya Hospital, where we are putting up an entirely new wing, an outpatient department, so that one will help the people of Nyeri town and the lower parts of Teto to be able to access better health care. We are working in Karatina, which is our level 3 hospital. Out there, we are putting in a new store. We are also working towards putting up a newborn unit, because the current one is pretty small. We have gone down to Mukurweini, where we are also working on we are building a new ward. We are also putting up a newborn unit. And finally, Othaya Hospital, which is the old Othaya Hospital, because we have 2 hospitals there. We have the new one, which we are yet to to occupy, and the current old one, where we are putting in a small incinerator. We are also working on the cabros, just to ensure that at least it has a facelift. Finally, we have Zainadi dispensary, which we are completing. And these are part of the things that, part of the plans we are doing. And why are we doing this? This is just in preparation for the universal healthcare, where our citizens, they that cannot afford to pay, will get the government of Kenya, led by Uhuru Muigai Kenyatta, paying for them the NHIF, which is a super cover, because this one will allow them to access affordable and wonderful healthcare.
Also, among the challenges that have been found within this particular system of the Universal Healthcare Program is the rise of non-communicable diseases. And as you've mentioned, is that Nyeri County found itself due to the high prevalence of non-communicable diseases. Last year, during Madaraka Day celebrations, President Uhuru Kenyatta promised to build a 5 billion shilling cancer center in the county. So how far are we with this particular project?
Thank you very much. Once again, we cannot fail to thank His Excellency the President for choosing Nyeri to receive that wonderful project. We have identified the land. We have already identified it and allocated it in Kimathi, and I have personally been there to ensure that it's land that is okay and fit for the hospital, and we are only waiting to strike and start the project. Yeah.
And finally, just briefly, if you could also mention, the Provincial General Hospital, that's the Nyeri referral facility, has been covered with a lot of challenge in terms of capacity of trying to probably get 2 patients having to stay in 1 bed. And we have the Othaya Hospital, which is, we can say, lying idle up until this point over the past 4 years. So how soon is this particular hospital going to be open to at least try and decongest the referral facility, which gets to serve a lot of people from Nyeri County as well as across the other central region?
Thank you. In Nyeri, we intend to do things differently. Remember, health is a devolved function, but we are in talks with national government that the Othaya Hospital should be made a level 6 hospital. That will benefit the people of Nyeri. The national government will be able to run it together with us, and we are really in very, very, very serious and advanced talks on how we can roll out and start the operations in Othaya Hospital. I must admit that national government has really done a lot. They have provided equipment, and we are still moving on with the final touches. We are agreeing on issues of how do we share out the staff and all that. So really, that is going to open up a new front, because it will help us decongest PGH, or the county referral hospital, where as late as yesterday I had visited you, because we find that some people have they opt to come to the county referral hospital when they could go to Mukurweini, they could go to Karatina, but they choose to come here. We also have Mount Kenya Hospital, which they don't visit as frequently as we would expect them to. But with the opening up and the launch of Othaya Hospital, where we are working very, very closely with the national government and also with Honorable Mugambi, Ichoke Mugambi, the MP for Othaya, towards realization of the dream of the, we can almost say the founding father of that hospital, His Excellency Mwai Kibaki, the third president of this Republic of Kenya. And we are praying that all will be well. We are committed towards ensuring that it doesn't matter who runs the hospital, do the people of Nyeri get services and good services for it.
Raquel?
Thank you so much, Governor. A very interesting strides there being made
Raquel,
by the Nyeri
hold on.
County
Can you hear
government.
me?
Mutahi Kaiga very passionate about
Can Raquel hear
health
me?
services. Yes, Linda.
Raquel, listen, I know that Nyeri is one of the pioneer counties, and indeed he has mentioned the strides that have been made by President Uhuru Kenyatta. But let me put him on the spot a little bit as the governor. What is he doing individually as the governor to ensure that his people, A, get to access affordable health care, and B, get all the services that they need?
Thank you, Linda. That is a question I will direct to the governor himself. What exactly, you've mentioned about what the county government is doing. What is it that you, as the governor of Nyeri County, is personally doing to ensure that the people of Nyeri get access to medical health care, have that premium quality to medical services within this county?
I think I've already said that I've allocated more than 35% of my budget towards healthcare. As soon as I finish this interview, I'm having a meeting with AMREF over the same. I am so committed, I'm so passionate that I'm driving this process myself. Yes.
Thank you so much. Linda, if you've had what Governor Mutahi Kaiga has mentioned is that he has allocated 35% of his budget to health matters within this particular county. And from what he can be able to see, even from what President Uhuru Kenyatta mentioned last year during the celebrations for Madaraka Day celebrations, in what appeared to be probably a political statement, Governor Mutahi Kaiga has been able to follow up with that to ensure that at least this particular cancer center that was promised to to residents of Nyeri, that will also get to serve residents from Muranga and Kirinyaga and other environments, will be able to enjoy this particular cancer center given the high prevalence of non-communicable diseases within this region. So it does appear that the universal healthcare coverage is not actually something that we can call a pipe dream, but it's actually going to be a reality in the days to come. Linda.
Raquel, thank you for speaking to us from Nyeri, focusing on universal healthcare. Nyeri is one of the pioneer counties that is set to receive this. Thank you for speaking to us from Nyeri. We are taking a break. When we get back from that break, we'll be speaking to our Elvis Kosgei, and he will be focusing specifically on the demand by governors to have immunity from prosecution following the arrest and charging of their Busia counterpart, Sospita Ojamong. We'll be back with Elvis in a couple of minutes.